Alors, merci beaucoup,
Thank you very much,
Jean-Sébastien. Bon
Jean-Sébastien.
après-midi, tout le
Good
monde. Good
afternoon,
afternoon. Today, I'm joined by my colleague, Minister Anita Anand, Doctors Tam and New, and Brigadier General Brody. Je voudrais maintenant inviter ma collègue,
I'd like to
la
invite
ministre
my
Anand,
colleague,
à
Minister
prendre la
Anand,
parole. Alors, à vous,
to
Anita.
take the floor. Anita.
Thank you so much, Dominic, and it's just great to be here with everyone today. I'm going to provide you with a brief update on where we stand regarding the procurement and delivery of COVID-19 vaccines. From the beginning, our government has said that all eligible Canadians will be able to be fully vaccinated by the end of September. Thanks to the groundwork that we laid by signing agreements with a variety of leading manufacturers, we are not only meeting but also exceeding our initial targets. Nous avions dit que nous allions recevoir 6
We
millions
had said
de
we would
doses au
receive
premier
6 million doses in the
trimestre
first
de
quarter of this
l'année
year,
et nous en avons reçu
and we received
9,5 millions de doses au
9.5
premier trimestre. Nous avions prévu entre
We
48
had
et
also
50
projected
millions de
between
doses
48 and 50
avant la
million
fin du
doses
deuxième
by the end of the
trimestre.
second
Nous
quarter,
sommes en voie de dépasser nos
and we are
prévisions
actually on
les
track
plus
to
élevées
beat the
de
top end
plusieurs
of that
centaines de
range
milliers
by
de
hundreds
doses.
of thousands of
In the first
doses.
quarter, we had projected that we would receive 6 million doses, and because of our aggressive negotiations, we accelerated this number and ultimately received 9.5 million doses of COVID-19 vaccines. We had projected between 48 and 50 million doses to arrive by the end of the second quarter, being the end of June, and we are on track to beat the top end of that range by hundreds of thousands of doses. We have delivered 44 million doses to the provinces and territories. As of yesterday, they have administered more than 36 million doses. And according to the latest numbers, 77% of eligible Canadians have received at least one dose of vaccine. À l'heure actuelle, le Canada demeure le premier pays
As it
du
stands,
G7
Canada
et
remains
du
first
G20
in the
pour le
G7
nombre de
and the
premières doses
G20
administrées.
for the
Et
number
chaque
of
jour,
first
de
doses
plus en plus de
administered.
Canadiens
And
reçoivent leur
more and
deuxième
more
dose.
Canadians are getting their
D'ici la
second
fin
dose
du
every
mois de
single
juillet,
day.
je peux vous
By the end of
confirmer
July, I
que
can
nous
confirm
devrions toujours être en mesure d'avoir reçu
that we remain on
environ
track to have
68
received
millions
approximately
de doses.
68 million
As it
doses.
stands, Canada remains first in the G7 and the G20 for the number of first doses administered. And more Canadians are getting their second dose every single day, including, I may add, myself. This morning, I am happy to report that I received my second dose from the vigilant healthcare workers staffing the Halton Regional Vaccination Clinic at the Oakville YMCA. Thank you so much. By the end of July, I can confirm that we remain on track to have received approximately 68 million doses of COVID-19 vaccines. All of this is a result of the Team Canada effort, which we have witnessed from the very beginning of this pandemic. While the end is in sight, we are not there yet, and we must remain vigilant. Vaccine supply chain disruptions, unfortunately, still occur. Case counts are following, but we still need to keep our guard up to ensure that vaccines continue to arrive in Canada. This is the work that my department and I will continue to do every single day, accelerating deliveries and ensuring arrivals of vaccines for Canadians. So let us all continue to exercise caution and follow public health guidance. And if you haven't yet and you are eligible, please get your shot and do your part to conquer COVID. Les vaccins sont ici et nous continuons d'en
The
recevoir.
vaccines are here.
Et si nous ne
More are
baissons
on their
pas la
way.
garde,
And if
nous
we keep up the
sortirons
fight,
de cette
we
crise
will
ensemble.
get through this
The
together.
vaccines are here. More and more are on their way. And if we keep up the fight, we will get through this together. Thank you. Miigwech. Merci beaucoup.
Thanks very much, Anita. And we'll now turn to Doctors Tam and then Dr. New. Dr. Tam.
Merci. Bonjour à tous. Nationally, 7-day rolling averages continue to decline. Our current national case count is down to less than 640 new cases reported daily. On average, 988 people with COVID-19 are being treated in our hospitals each day, including 486 in intensive care units, and an average of 14 deaths are being reported daily. But the big news is what's continuing to go up. And this past Sunday, the city of Toronto rose to the top when, at a single vaccination clinic, Torontonians stepped up to break through the Canadian one-day record and fly past the North American record to score a worldwide record of almost 27,000 doses given during a day dubbed #Vaccine Day. People all across the country can take pride in this record because so many have stepped up to get vaccinated and encourage others. This is a winning shot for everyone. And though we still need to get more sleeves up for the first and second doses, keep up with precautions as immunity builds across our communities, and listen up to public health advice for awareness of local COVID-19 risks, more and more of us are asking, when can we hug our loved ones? In particular, grandparents, aunts and uncles are looking for advice for when they can share hugs with the kids in their lives. The answer is, because children under 12 are not eligible for vaccinations yet, there is still a risk they can get infected with COVID-19 and pass the virus on to others. However, if you and everyone else around them are fully vaccinated, the risk is lower. By assessing everyone's risk and comfort levels, you can determine if additional personal preventive practices are needed when hugging or being close in person, such as wearing masks and gathering outdoors. During this time of transition, many people may feel more comfortable continuing with individual precautions such as mask wearing and physical distancing. Let's continue to support each other by respecting each other's personal risk comfort levels. As well, we should all remember that simple things like frequent hand washing and staying home when we have symptoms also reduce risk of many infectious diseases and continue to be important. So let's keep working it up together to get Canadians protected and vaxxed to the max. Thank you. Merci. And miigwech.
Bonjour à toutes et à tous. À l'échelle nationale, les moyennes mobiles
day,
sur
everyone.
7 jours continuent de
Nationally,
baisser. Le
7-day
nombre
rolling
moyen
averages
de cas
continue to
déclarés au
decline.
pays a diminué
Our
pour
current
atteindre
national
moins
case
de
count
640
is
nouveaux
down
cas
to
par
less than
jour. Le
640 new
nombre
cases
moyen de
reported
personnes
daily.
atteintes de la COVID-19 traitées
On
dans nos
average,
hôpitaux chaque
988
jour est de
people with COVID-19 are being treated
988.
in our
De
hospitals
ce
each
nombre,
day,
486
including
étaient traités dans des unités
486 in
de soins
intensive care
intensifs
units,
et en moyenne,
and
14
an
décès
average of
ont été
14 deaths
déclarés
are being
par jour.
reported
Mais
daily.
la grande nouvelle est ce qui continue
But the big
d'augmenter.
news is what is
Dimanche
continuing to
dernier,
go up.
la ville de Toronto s'est
And this
démarquée
past Sunday,
alors
the
que
city
dans
of
un même
Toronto
lieu de
rose to the top
vaccination,
when at a
les
single
Torontois
vaccination
ont
clinic,
relevé leur manche
Torontonians
et ont
stepped
battu
up
le record
to
canadien
break
d'un
the
jour.
Canadian
Ils
one-day
ont aussi
record
pulvérisé le record
and fly past the
nord-américain
North
et
American
établi
record
un record
to score a
mondial avec
worldwide
près de
record
27 000
with
doses
almost
inoculées en
27,000
une
doses
journée,
given during a
surnommée
day
mot-clic
dubbed
Vaccine Day. Les
#Vaccine
gens de
Day.
tout le pays peuvent être
People
fiers
all
de ce
across the
record,
country can take
puisque
pride in
tant de
this
personnes
record
se sont fait
because
vacciner
so
et
many
ont encouragé les
stepped
autres à
up
le
to
faire.
get vaccinated and encouraged
Nous en
others.
sommes tous gagnants.
This is a winning
Toutefois,
shot for
toutes les
everyone.
personnes doivent relever leur manche pour obtenir leur
And
première
though we
et
still need to
seconde
get more
dose.
sleeves
Il faut
up for
continuer
first and second
d'observer les
doses,
précautions
keep
à
up
mesure
with
que l'humidité
precautions as
s'accroît
immunity
dans
builds
nos
across our
collectivités et
communities,
de suivre des
and
conseils de
listen
santé
up to
publique
public health
en ce qui
advice
a trait
for
aux risques
awareness of
liés à la
local
COVID-19 de
COVID-19
chaque
risks.
région. De plus en plus de personnes
More and
parmi
more of
nous
us are
se
asking,
demandent quand pourrons-nous serrer de nouveau
when
nos
can
proches
we
dans nos
hug our
bras?
loved ones
En
again? In
particulier, les
particular,
grands-parents, les
grandparents
tantes et les
and
oncles
uncles
cherchent à
are looking
savoir
for advice
quand ils
for
pourront
when they can
donner
share
des
hugs
câlins
with the
à leurs
kids
petits-enfants
in their
et leurs
lives.
neveux et nièces. La réponse est puisque les enfants de moins de 12
The
ans
answer is
ne
because
sont
children
pas
under
encore
12
admissibles
are not
à la
eligible for
vaccination,
vaccination yet.
il y a encore un risque qu'ils
There
contractent
is
le
still a risk
COVID-19 et
they can get
transmettent le
infected with
virus.
COVID-19 and
Toutefois,
pass the
si toutes
virus
les
on
personnes de leur
to others.
entourage sont
However,
entièrement
if you and
vaccinées,
everyone else
le
around them
risque
are
est plus
fully
faible.
vaccinated, the risk is
En
lower.
évaluant le risque et le seuil
By
de
assessing
tolérance de
everyone's risk
chacun
and
à
tolerance and
celui-ci, vous
comfort level,
pouvez déterminer
you
si des
can
mesures de
determine if
prévention
additional
personnelle
personal
supplémentaires
preventive
sont
practices are
requises,
needed when hugging or
notamment
being
le
close in
port de
person,
masque ou les
such as wearing
rencontres
masks
à
and
l'extérieur
gathering
pour être
outdoors.
à proximité d'une autre personne ou pour donner des câlins. Pendant cette période de transition,
During this
de
time of
nombreuses personnes
transition,
peuvent être
many
plus à
people
l'aise de continuer
may
à
feel more
prendre
comfortable
des
continuing
précautions
with individual
individuelles comme le
precautions,
port de masque
such
et
as
la
mask wearing and
distanciation
physical
physique.
distancing.
Continuons de nous
Let's
soutenir
continue to
mutuellement
support each
et
other
en respectant le
by
seuil de
respecting
tolérance
each other's
au risque de
personal
chacun.
risk,
De plus,
comfort
n'oublions pas
levels.
que des simples
As
gestes
well,
comme
we
le
should all
lavage
remember that
fréquent des
simple
mains
things
et
like
le fait de
frequent
rester
hand
à la
washing and
maison,
staying home
si
when
nous
we have
présentons
symptoms
des symptômes,
also
réduisent
reduce
également
risk
le risque lié
of many
à de
infectious
nombreuses
diseases
maladies
and
infectieuses. Ce
continue
sont toujours
to be
importants.
important.
Alors, continuons de
So let's
travailler
keep
ensemble
working
pour
together
protéger
to
les
get
Canadiens
Canadians
et
protected
faire en sorte que le plus grand nombre possible
and
d'entre
vaxxed to
eux
the max.
soient vaccinés. Merci.
Thank you.
Thank you.
Merci.
Miigwech.
Miigwech.
Go Habs go.
Thank you. Thank you very much, Dr. New and Dr. Tam. We'll now turn to Brigadier General Brody.
Over the past 7 months, we have delivered nearly 45 million COVID-19 vaccines across the nation, first in smaller numbers, and now in substantial volumes on a weekly basis. By the end of this week, we will have brought in 50 million doses to immunize Canadians. This includes provincial allocations currently managed in central inventory by the Public Health Agency of Canada, ready to be called forward to support vaccination strategies at the time and place of provinces' choosing. This inventory management approach allows us to minimize wastage while ensuring that we can continue to vaccinate as many people in Canada as quickly as possible with both first and second doses. This week's distribution of 2.4 million doses of Pfizer-BioNTech is well underway, with close to 2 million of those doses already delivered to vaccine delivery sites across the provinces. Moderna deliveries, carrying over from last week's allocations, are also ongoing. This week's allocation of 1.4 million doses arrived today for delivery late this week and into next week. Moving forward, we are still tracking allocations of Pfizer-BioNTech in July, totaling 9.1 million doses, and we are working with Moderna to confirm upcoming delivery schedules for the balance of July's allocation. We are not done yet. We are carefully monitoring upcoming supply to ensure that Canadians have the doses required to maximize vaccination rates across all eligible populations. D'abord, en plus petit nombre et maintenant en quantité importante chaque semaine, nous avons, au cours des 7 derniers
Over the
mois,
past 7 months,
livré environ
we have delivered
45 millions de
nearly
doses de vaccins
45
contre
million
le COVID-19
COVID-19
partout au
vaccines
pays.
across the nation, first in smaller
D'ici la fin de
numbers
cette semaine,
and now
nous
in
aurons
substantial
amené
volumes on a
50
weekly
millions de
basis.
doses pour
By the end of this week,
l'immunisation des
we will have
Canadiens et
brought in
Canadiennes.
50 million
Ce
doses
nombre
to
comprend les
immunize people
allocations
in
aux
Canada.
provinces
This includes
actuellement
provincial
gérées
allocations that are currently
intervenir
managed
centralisées
in central
par l'Agence
inventory
de la
by
santé
the Public
publique
Health
du Canada,
Agency of Canada,
prête à être achetée
ready to
pour
be called
appuyer les
forward
stratégies de
to support
vaccination des
vaccination
provinces
strategies
au moment
at the
et à
time
l'endroit
and
qui leur
place of
conviennent.
provinces choosing.
Cette approche de gestion de l'inventaire nous permet
This
de
inventory
réduire le
management approach
gaspillage
allows us
tout
to
en nous
minimize
assurant de
wastage
vacciner
while
avec la
ensuring
première
that we can
et la
continue to
seconde
vaccinate as
dose
many people
le
in
plus grand
Canada
nombre possible
as
de
quickly as
personnes au
possible
Canada et le plus rapidement
with both first
possible.
and second doses.
Cette semaine, la distribution des
This week's
2,4
distribution of
millions de doses de
2.4 million
Pfizer-BioNTech
doses of
est bien amorcée.
Pfizer-BioNTech is well
2
underway,
millions de ces
with
doses
close to
ont
2
déjà
million
été
of those
livrées
doses
et des
already
sites de
delivered to
livraison de
vaccine
vaccins dans
delivery
les
sites
différentes provinces.
across the provinces.
Les livraisons de vaccins de
Moderna
Moderna,
deliveries,
quantité restant des
carrying over
allocations
from
de la
last
semaine
week's
dernière,
allocations,
sont également
are
en
also
cours
ongoing.
et Nous avons reçu l'allocation de cette semaine
This
qui
week's
est de
allocation
1,4
of
million
1.4
de doses
million doses
aujourd'hui
arrived
que
today
nous
for
distribuerons
delivery
dans les
late
prochains
this
jours
week
et au début de la semaine
as well
prochaine.
as into next week.
Par la suite, nous continuons de s'entendre à
Moving forward,
recevoir les allocations de
we are
Pfizer-BioNTech
still
pour
tracking
le mois de
allocations of
juillet, qui
Pfizer-BioNTech in
totalise
July,
9,1 millions de
totaling
doses. Et nous
9.1
travaillons
million
avec Moderna
doses, and we
pour
are working with
obtenir une
Moderna to
confirmation de
confirm
calendrier de
upcoming
livraison
delivery
pour
schedules
le reste des
for the
allocations
balance of July's
du mois de
allocation.
juillet. Ce n'est pas encore terminé.
We are not
Nous
done yet.
surveillons de près
We are
l'approvisionnement à
carefully
venir
monitoring upcoming
pour nous
supply
assurer que
to
les Canadiens et
ensure
les Canadiennes ont accès
that
aux
Canadians
doses
have the
nécessaires
doses
pour
required
optimiser
to
les
maximize
taux de
vaccination rates
vaccination pour toutes les
across all
populations
eligible
admissibles.
populations.
Merci.
Thank you.
Miigwech.
Thank you very much, General Brody. So, Jean-Sébastien, à vous maintenant. Ça nous fera plaisir, évidemment, de prendre des questions.
Jean-Sébastien will be happy to answer any questions.
Merci beaucoup, Monsieur le ministre.
Thank you very much, Minister.
Donc, tel que mentionné, nous allons maintenant débuter la période de questions. Ministers, doctors, and the Brigadier General will now be happy to take your questions. As usual, it will be one question and one follow-up. Comme d'habitude, ça va être une question et un suivi par journaliste. And I will now pass it over to the operator for the first question. Je vais maintenant passer la parole à l'opérateur pour la première question.
Thank you. Merci. Please press *1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. The first question is from, la première question est de Mia Rapson, the Canadian Press. Please go ahead. À vous la parole.
Yeah, good morning. Dr. Tam, my first question is for you about mask wearing. I'm just curious, I think you had said that when about 75% of Canadians were fully vaccinated, that's when we could start to think about relaxing things like masks and physical distancing. But we've seen more recently calls in England and in Israel, I'm thinking specifically, to continue masks or bringing back mask mandates because of sort of a resurgence in cases. What do you think the Delta variant means for mask wearing, and how long do you think Canadians could expect to need masks or be suggested to wear masks?
Yes, thank you for that question. And of course, we're learning about variants and viruses every day, and certainly the experience in other countries do help inform us. Last Friday, I also showed some new modeling that included, amongst other things, the parameters of the Delta variant in terms of transmissibility and potential for increased impact on hospitalizations. And there we suggest that we could prevent the fourth wave if we can get the vaccine coverage even higher, and including 80% vaccine coverage in the younger adult populations to try and reduce the transmission. So I think it's a combination of things in terms of about mask wearing. And I think we do have to be quite cautious because the provinces are just beginning to open up, and we will then see what happens. Even though we have a good first dose coverage, we still need to, I think, go a bit higher. And quite a number of people haven't had the full vaccination. So this is a period, I think, that we should be more cautious. Having said that, I think that has reduced, you've seen the combination of public health measures and the vaccines reducing the impact in our communities. As things ease up, we just have to watch very carefully on what transmission looks like. At the same time, people wanted some guidance as a rule of thumb, if you like, a framework to work with for individuals who've been fully vaccinated. And we provide some of that on Friday. But still, I think in terms of being precautionary, still think about those fundamental principles of reducing your risk and where risk could be higher. For example, the 3 C's we keep talking about, things, close contact, confined, crowded spaces. Try to reduce all of those things still. We're still not quite there with vaccination coverage, and this is a period of prudence, but I hope the guidance provides some measure of yardstick for people to look at the individual situation. And I keep saying that, life after vaccination guidance is not the same for everyone everywhere. And it's not the same in Manitoba or the Yukon right now compared to maybe in the Atlantic provinces. So you do have to still follow local public health advice.
Okay, thanks. I'm sort of more talking about whether mask mandates were needed, but my second question is for Brigadier General Brody. You mentioned an inventory management approach to vaccines. I'm wondering if you could provide a little bit more information about what that means if you're holding back significant portions of all vaccines. I know last week you'd mentioned AstraZeneca being held in back sort of for distribution as provinces requested them. Just looking for a bit more explanation of what that inventory management approach is and how many doses Ottawa is keeping aside.
At this point, we're not holding doses on behalf of the provinces as part of a federal allocation. What we're doing is assisting the provinces in managing their inventory based on their per capita allocations as confirmed shipments come in. And as over the last several weeks, as we have brought more and more significant volumes of vaccine in, we have partnered with the provinces in some cases to help manage their inventory by giving them the option of drawing their allocations down in full or in part as they move through the weeks and support their individual campaigns and programs. We have brought in 795,000 doses of AstraZeneca in the last couple of weeks. Some of those doses were allocated for the provinces based on requirements that they had identified, and a small portion is being held within our federal inventory to offset any requirements as they evolve. So certainly the situation is evolving on a day-to-day basis. We continue to bring in vaccines to ensure that we have the sufficient quantity and types of vaccines that Canadians need in order to continue our vaccination campaigns. With confirmed deliveries alone, we expect that by the end of July, we will have sufficient vaccine supply to vaccinate upwards of 90% of the eligible population, and that is tremendously good news. And as we track closer and closer to those optimal levels of doses, we'll further refine our inventory management approach to ensure that Canadians have all the doses that they require now and going into the future, and that we're well postured for next steps. Thank you.
Thank you, Brigadier General. Opératrice, à vous pour la prochaine question. Operator, over to you for the next question.
Thank you. Merci. The next question is from La prochaine question est de David Schickman, le CBC News. Please go ahead. À vous la parole.
Hi, yes. Hello, everyone. We have a story up about the Johnson & Johnson vaccine on cdc.ca. Basically, we don't know when we're getting any new shipments. So I guess this question is for Dr. Tam and potentially for Minister Anand. What concern do you have about not receiving any of this one-shot dose? I know we're receiving lots of other vaccines, but this vaccine, the J&J vaccine in particular, was counted on as being, this great help to vulnerable populations here in Canada who might not come back for their second dose. So yeah, what concern do you have about not receiving, any update on when we're going to be getting these doses?
I'll start. Thank you so much for the question. So last summer, we put in place a diverse portfolio of vaccines with leading vaccine manufacturers on the advice of the Vaccine Task Force and the Public Health Agency of Canada, and J&J was one of those companies. We signed an agreement with J&J for 10 million doses of the single-shot vaccine. And that contract remains in place and will be able to lead to additional deliveries of the J&J vaccine to Canada should the provinces and territories need or require that vaccine. At the current time, there are discussions ongoing with the provinces and territories regarding their desire to receive the vaccine. In other words, there's an assessment of demand that is occurring, and there's a conversation between the federal government and the provinces and territories on that point. So decisions are still being made regarding the J&J vaccine deliveries, but by all means, that contract is still in place and still able to yield vaccines for Canadians if the demand is there. I will just add that the numbers of vaccines and vaccinations in this country at the current time are high. 44 million doses of vaccine have been delivered. 36 million doses have been administered. 77% of eligible Canadians have had at least one dose, and over 30% of Canadians are fully vaccinated. We're first in the G20 for the share of the population with one dose. This is on the basis of 2 mRNA vaccines, Pfizer and Moderna. To be clear, we have procured 51 million doses of Pfizer, 44 million doses of Moderna, as well as AstraZeneca. But as I said at the beginning of my response, the J&J contract remains in place, and if the demand is there for that vaccine, we will be able to supply the provinces and territories with it. I'll turn it over to Major Brigadier General Brody to supplement my answer in case she has anything on the terms of the negotiations with the provinces and territories. Thank you.
Thank you, Minister. At this point in time, we are not receiving a strong demand signal at all from the provinces, so we continue to leave those communication channels open. If we do receive a signal from the provinces indicating demand, then we certainly have the mechanisms, as Minister Anand indicated, to bring that vaccine in. At this point in time, we are focused on the mRNA vaccines, which are those that are really in demand by the provinces in order to accelerate those second dose strategies and to really get as many first doses as we can as soon as possible. So at this point in time, the demand is really focused on the mRNA vaccines. Thank you, Minister.
Follow-up, David?
Yes. So this is a totally different question, and it's for Minister LeBlanc. So, Minister, the LGBTQ plus community, we're counting on the government to pass the conversion therapy bill. The Senate rises today. People are worried the legislation won't make it through the upper chamber. So I guess the question to you is, what does this say about how seriously the Liberals are taking this issue? Are you worried the legislation won't pass? Why have we gotten to this, 12-hour situation where this really important legislation that's really important to the LGBTQ plus community might not get passed? It's in limbo, essentially.
So first of all, we certainly understand the importance of this legislation. Liberals and the government introduced this bill precisely because we recognize the importance and accept the importance that the LGBTQ community has shown for this legislative action as well. I would have you note that 62 Conservative members of Parliament in the House of Commons voted against the legislation. We believe that the Senate should study this legislation and should adopt this legislation. We're calling on the Senate to do what is necessary to bring this legislation to royal assent. We've also taken note of a number of Conservative senators who have resisted supporting this type of legislative amendment in the past. And we certainly hope the Conservatives in the Senate aren't going to frustrate the clear will of the majority of elected representatives in the House of Commons and certainly the Liberal government to pass this legislation. So I'll continue to work with my colleagues, the Minister of Justice and our representative in the Senate to impress upon the Senate the importance of bringing this legislation to royal assent. So we understand the concerns of the LGBTQ community. We are of the same view that they are. And we regret that so many Conservatives oppose this legislation, but we're certainly not going to give up until it receives royal assent.
Thank you, Minister. Operator, next question. Opératrice, prochaine question.
Thank you. Merci. The next question is from La prochaine question est de Catherine Lévesque, La Presse canadienne. Please go ahead. À vous la parole.
Oui, bonjour à vous tous. En fait, M. Leblanc, je me
Yes,
permets
good
de
day,
vous poser
everyone.
environ la
Mr.
même
Leblanc
question.
actually had the same, almost the same
Mais
question
surtout
for
en
you.
voulant savoir comment est-ce que
But
vous vous attendez à ce que le
with this
Sénat
angle,
passe
how do you
4 projets de loi
expect the Senate
assez
to
importants en
pass
quelques
4
heures, et
significant
ça
bills
alors
in a
que ces
few
projets de
hours
loi ont quand
only
même
when these
été adoptés à la
bills
Chambre des communes à la
were
11e heure
passed
la
at the
semaine
11th
dernière?
hour, actually, in the House of Commons last week?
Écoutez, nous reconnaissons l'obligation
We
du Sénat de
recognize the
faire son
Senate's
travail.
obligation to do its work.
Cependant, le fait que ces projets de loi
Nevertheless,
ont
the fact
été
that these
adoptés à la
bills were
dernière heure
passed at the
est en très
last,
grande
at
partie
the
à
11th hour
cause
is in
des
large
tactiques
part
de
because
l'obstruction
of
des
the
conservateurs à la Chambre des
Conservatives'
communes.
filibustering
Les
tactics at the
conservateurs
House
ont
of
depuis
Commons
des
in the House of
semaines à la
Commons.
Chambre des
For
communes
weeks now, the Conservatives in
utilisé
the
toutes
House of
sortes de
Commons
manœuvres
have
procédurales
used a
pour
host of
empêcher la
procedural
Chambre des
maneuvers
communes
to
à se
prevent the House of
prononcer
Commons
et
from
à voter
making
sur
these
des projets de loi.
decisions, voting
Alors,
on
c'est en
these
très grande
bills.
partie
So it's in the
la
very
faute des
large part the
conservateurs si
Conservatives'
on a
fault
été obligé de
that
forcer
we
à la dernière
had
minute
to
avec
arrive at
des
this
séances
stage where we're
prolongées
at
avec
the very
l'appui,
last minute
il faut
holding
dire, dans certains
extended
cas du
sessions
Bloc
with,
et
in some
des
cases, the
NPD. C'est la
support
seule
of
façon
the
que nous
Bloc and the
avons pu
NDP. This is the only way
ultimement
we've
amener
ultimately
ces projets
managed
de
to
loi,
bring
comme
these
par exemple
bills
la thérapie de
forward, like
conversion,
this conversion therapy bill,
ou les amendements, le projet de
or
loi C10,
the
tellement
amendments, Bill
appuyé par des communautés
C10,
artistiques et culturelles au Québec
supported by
et partout au
cultural and
Canada.
artistic communities
Il
throughout
fallait
Quebec
des alliés à
and
la Chambre
all
des
of Canada.
communes.
We
C'est ça
needed
que nous
allies in
avons
the
fait.
House of Commons. That's
Et
what we
nous
did.
espérons que
And
le Sénat
we
va
hope
prendre
that
ses
the Senate will
responsabilités. Il n'y a pas de magique
really
à
take its
dire que le Sénat ne devra
responsibilities
pas
here,
siéger au mois de
and
juillet. Nous pensons que c'est des projets de loi importants.
we think these
Ça
are
représente
important
la
bills.
volonté
They
des
represent
députés à la Chambre des
the
communes,
will
dûment
of
élus à la Chambre des communes. Alors, nous allons continuer
duly
de travailler
elected
avec le Sénat
representatives
afin
in the House of Commons. We will continue to
qu'on peut
work with the
amener ces
Senate so
projets de
that these
loi
bills
à une sanction
can
royale.
come to royal assent.
Merci. Je voulais aussi vous entendre sur en fait une
wanted to
annonce
hear
que le chef conservateur Aaron O'Toole a fait aujourd'hui.
about the
Dans le fond,
announcement
il
made by
promet
Aaron
que
O'Toole today.
son parti est porté au
He
pouvoir aux
is
prochaines
saying
élections.
that
Dans
if
le
his
fond, les
party is
conservateurs
elected in
promettent
the
d'instaurer
next
un plan
elections,
de
the
préparation
Conservatives
d'urgence
will
pour la
have
COVID-19, mais aussi pour
a
toutes les
COVID
futures pandémies.
emergency plan in
Si je
place for
résume, ils
COVID,
veulent
but for all other
établir des
types of
partenariats avec les
pandemics. They
sociétés
intend to
pharmaceutiques pour
create
la fabrication de médicaments. Ils veulent travailler
pharmaceutical
avec les États-Unis pour renforcer la
cooperative
chaîne d'approvisionnement nord-américaine.
systems, want to strengthen the North American chain of distribution. They also want to strengthen the government's response to the pandemic. Would you have an answer to that, Mr. Leblanc or Madame Anand? Unfortunately, the interpreter regrets some of that was inaudible.
Si Anita veut ajouter
Answer.
quelque chose,
I
ce
may
sera
start, and then
parfait.
Anita could perhaps add
Nous
if
sommes
she
contents
would
que
like.
M. O'Toole
We are pleased
arrive
that
aux mêmes
Mr. O'Toole is
conclusions
arriving at the
que notre
same
gouvernement.
conclusions as our
Nous
government.
avons reconnu depuis le début de la
Have
pandémie
recognized
que
from
le
the
Canada
start of the
était dans une
pandemic
situation
that Canada
difficile à
has found
cause
itself in a
du fait
difficult
qu'au
situation
fil de
due to the
plusieurs
fact
décennies,
that over
la
several
capacité
decades,
de biomanufacturier au Canada a été énormément
manufacturing
diminuée.
capacity
Mon
in
collègue,
Canada
le
has been
ministre
greatly
François-Philippe
diminished.
Champagne,
My colleague, Minister
avant lui, le
François-Philippe
ministre
Champagne,
Baines,
Minister Baines
et tout le
before him,
gouvernement.
and the entire government.
D'ailleurs, nous avons
In
annoncé
fact,
à
we
plusieurs
announced
reprises
on several
des projets
occasions
importants au fil des
important,
centaines de
significant
millions de dollars
projects,
avec l'industrie
hundreds of millions of dollars
et nous
worth
avons
with the
d'autres bonnes
pharmaceutical
nouvelles
industry, and we
dans
have
les prochaines
further
semaines,
good news in the coming weeks,
précisément pour s'assurer
specifically in order to make sure that Canada is ready in the event of any future pandemic. And it's not only about vaccines or therapeutics. We've also seen that with personal protective equipment, my colleague Anita worked very hard over the first few months of the pandemic to make sure that, specifically about this issue, that Canada was well equipped, whether it be the federal government or the provinces. In fact, we did not have robust enough protections in place. We will make sure that a national government never finds itself in this situation again. And the Prime Minister and the Minister of Health have also indicated that when the pandemic is over, we will, of course, take the time to review what went well, what could have gone better, and give any future Canadian government all the necessary answers to protect Canadians. So Mr. O'Toole is arriving, in fact, to the same conclusion our government arrived at months and months ago. In other words, we have an obligation to make sure that we will be much more well prepared if ever we end up in the same situation. Anita may have something to add, or someone else?
Oui, merci beaucoup,
yes, thank you very
Dom.
much.
Bien sûr, lorsque cette pandémie a commencé,
of course, when the
le
pandemic
Canada
started,
ne disposait
Canada
d'aucune capacité
had
de bioproduction
no
convenant à un vaccin COVID-19.
bioproduction capacity in-house to produce vaccines. The underinvestment in the vaccine capacity, production capacity, started decades ago in the previous century. We immediately understood we needed to invest, as Dominic has said, in our domestic production. We also realized we needed to increase our facilities, the number of facilities, which we've done. The government has already aggressively invested in new biomanufacturing capacity. In fact, we have taken serious measures on this front even before the pandemic, and in our first term, we reestablished our capacity to invest in science, life sciences. We have constantly been increasing our investments in a targeted way since the beginning of the pandemic. We're talking about major investments in production capacity, such as Medicago and the National Research Council. And this is why the 2021 budget plans for $2.2 billion over 7 years to ensure the growth in a national sector. And these are areas, a life cycles area, where we're talking about many good jobs for the middle class. The Conservatives have voted against this investment. These investments will help create a talent pool and a research system for Canada. These investments will support the growth in the life sciences sector industries.
That in addition to all of these commitments to domestic manufacturing, at the same time, we are pulling in record numbers of vaccines, such that Canada is atop of the world in the administration of first doses. We've delivered 44 million vaccines to provinces and territories, 36 million of which have been administered. So our strategy is twofold: to build up domestic biomanufacturing on the one hand, and to bring in deliveries of vaccines for Canadians in record numbers. And we will continue to operate on these two tracks so that Canadians are well served, so that Canadian jobs are well served, and so that Canadian sciences are well served. Thank you.
Thank you, Minister Anand. Operator, next question. Opératrice, prochaine question.
Thank you. Merci. The next question is from La prochaine question est de Sarah Turnbull, CTV News. Please go ahead. À vous la parole.
Hi there. Thanks for taking our questions. This one is for Dr. Tam. There's increasing speculation that a federal election could be called this summer or fall. Has the Prime Minister consulted you on how to campaign safely? And do you think Canada is in a safe enough place with COVID-19 to have a national campaign?
No, I have not been consulted on this matter. But we do have already published guidance on the type of public health measures that should be observed. And of course, the Chief Electoral Officer will take some of the those considerations in mind as they go about operationalizing any kind of election. So that kind of dialogue has been taking place throughout, the pandemic itself, really just to make sure people understand the guidance. And but in the end, of course, you also have to take into account what's happening locally at the time. So even now, as I said, Manitoba might be a bit different from Ontario, and maybe even within Ontario, there's different epidemiology. So local public health has to engage with the teams from the Chief Electoral Officer and Elections Canada. I think that's where the engagement occurs.
Okay, thank you. And I think for Dr. Tam as well, the new border changes are set to come into place on July 5th in just a few days. Is there any more information you can provide on sort of the privacy component, or how are you going to ensure there's the security of travelers' vaccination documentation on the ArriveCan app? Has there been any consultation with the Privacy Commissioner on this? Are you concerned about the privacy element? That kind of thing.
Yes, thank you for that question. And if needed, some follow-up can be done with the teams that actually work on ArriveCan. But as with any of these key initiatives, the proper consultations have been done. So that does involve the collection of information with the ArriveCan, including vaccination. And I think is essentially mandatory to use ArriveCan, but obviously whether you upload any vaccination information is also up to the individual as well. And so I think there's checks and balances in all of that process. But yes, I could certainly refer you to colleagues who actually work on the app. But based on what I know, these consultations were done. And I'm not sure if Minister LeBlanc actually has any more information on that front.
Thank you, Dr. Tam. And obviously, our colleagues at the Canadian Border Security Agency take the privacy concerns of Canadians very seriously. One of the things that our government wants to do in terms of developing, in partnership with the provinces and territories, the appropriate proof of vaccination credential for international travel is precisely to ensure the security and privacy of the personal health information of Canadians. We obviously have confidence in the ArriveCan app to date, but it is but a transitional measure until we get to a longer-term international proof of vaccine credential. And the appropriate authorities, obviously working with provinces and territories as well that share these same concerns, will be in touch with the Privacy Commissioner and others to ensure as we develop these options that we're respecting the privacy rights of Canadians.
Thank you, Minister. Opératrice, prochaine question. Operator, next question.
Thank you. Merci. The next question is from La prochaine question est de Mylène Crête, Le Devoir. Please go ahead. À vous la parole.
Bonjour. J'aimerais revenir sur la question qui avait été posée
I'd like
au
to
début
get
par
back to
ma
the
collègue
question
Mia Rabson.
asked by
C'était
Mia
concernant le
Rabson
port du
regarding
masque
the mask
à la
mandate
lumière là, de
in light
l'arrivée potentielle du
of
Delta variant au
the
Canada, ou en tout cas
potential
d'une
arrival of the
plus
Delta
grande
variant in Canada,
multiplication des cas. Donc, je me demandais,
or at least
est-ce
an increase in
que
the
vous
number of those
considérez qu'il
cases.
serait pertinent
Would
de
it be
conserver le port
possible
obligatoire du masque
do you think
en
it's
attente de la quatrième
advisable
vague et peut-être
to
même
maintain this mask
probablement pendant?
mandate in anticipation of this other wave or even during?
Excusez-moi. Merci pour la question. C'est Dr. New. Peut-être je peux
Thank you for the
commencer avec
question.
une
This is
réponse.
Dr. New. I can
Oui,
start with an
on
answer.
suit étroitement la
We are
situation ici au
closely
Canada, mais
following the
aussi
situation, of
à
course, in
travers le
Canada
monde et
and
aussi
throughout the
avec
world,
l'expérience
as
dans les
well
autres pays
as with the experience of
concernant
other
les
countries,
variants
given
préoccupants,
these
incluant
variants
le
of
variant
concern,
Delta.
including the Delta
Et
variant.
ce qu'on voit, c'est sûr que
What we're
le
noting
variant Delta
is
est
that
plus
clearly
transmissible,
the
aussi
Delta variant
peut
is
avoir
more
les conséquences
transmissible,
plus graves
and that
si
can have
on
more
est
severe consequences
infecté avec le
if
virus.
one does
Ici au
get infected
Canada,
with the
à l'heure
virus.
actuelle,
In Canada, at this point,
les nombres de cas signalés par jour, mais
the
aussi
number of cases
l'impact sur
that
le
we have
système de soins de
detected per
santé,
day, and
on est dans
also given the
une bonne
healthcare
place, mais
system as it
c'est
stands
sûr
today, we're in
qu'il ne faut
a
pas
good position,
assouplir les
but of
mesures de
course,
santé
this
publique
means we shouldn't
trop rapidement. Donc, je
do
pense
away with
qu'avec
these public
nos
health
collègues
measures
des
right
provinces
away.
et territoires, tout le monde
I think all
sait
provinces and
exactement qu'est-ce qui
territories,
peut
all of our
arriver. Donc, je pense
counterparts and
qu'avec
colleagues know
l'assouplissement
what can happen once
des
we
mesures de santé
loosen
publique, on
these
voit qu'est-ce qui
rules
se
and
passe dans
public
les
health.
provinces et
We see
territoires.
the results of what
On
happens
est
in the
dans
provinces and territories. How can we put it?
position
We're in a
donner des
position
conseils
where we can
à monsieur,
provide
madame, tout le monde,
advice
même nous autres ici à l'échelle
to
fédérale,
people
avec
everywhere in Canada, and even at the federal
conseils, qu'est-ce
level,
qu'on
with,
peut faire si on
so we
est
can provide some advice, such as
vacciné avec les
what can you
deux doses
do
de
if you've gotten
vaccin,
both
qu'est-ce
doses
qu'on
of the
peut faire
vaccines,
avec
what can
nos
you
amis,
do with your
notre famille,
friends, your family,
mais
but
avec ce qui se passe, et c'est toujours important de
given what's
souligner
happening,
le
and it's
point
important to
qu'il
really
faut augmenter
reiterate the
la
fact that we
couverture
need to
vaccinale parce que le
increase
plus
the
grand nombre
vaccine
des
coverage,
Canadiens
because
protégés contre la
more
COVID-19 en
Canadians
général, mais aussi
protected
contre le
against
variant, c'est toujours mieux pour les
COVID-19
pays.
means more
Mais
Canadians protected
on
against this
voit qu'est-ce qui
variant,
se
and
passe
it's
dans
better
les
for
autres
the
pays
country.
et c'est
But we're
sûr
seeing
que
what's happening in other
si on
countries.
continue à suivre
Clearly, if
étroitement
we
la
continue
situation
to follow the
épidémiologique au Canada,
situation
et on commence, je pense,
epidemiologically in
peut-être
Canada, and I
dans
think
peut-être une
with,
région à l'échelle
let's
locale ou
say
peut-être
we
dans
were to start with a local
une province ou
region
territoire
or a province or
individuel, une
territory, if
augmentation
we were to note
des indicateurs
indicators
nous
of an
démontrent que
increase,
peut-être le variant de Delta ou les
let's say
autres
there's an
variants
increase in
préoccupants
Delta
commencent à
or
avoir
any
plus
other
d'un
variant,
impact. C'est
if we
sûr que
see these
les
variants having more
autorités
of an
de
impact,
santé
then
publique,
clearly public health authorities
peut-être à l'échelle locale ou
at
peut-être
the
à
local
l'échelle
level
provinciale
or
peuvent
provincial
toujours
level
mettre en place les autres mesures de santé
can
publique, peut-être,
bring down these
comment
other
dire, le
public
port
health
de masque
measures, such
obligatoire
as
encore dans
mandatory mask
certaines
wearing
circonstances.
under some
Merci.
circumstances. Thank you.
Ma deuxième question, je me demandais à quoi est-ce qu'on peut s'attendre à l'automne pour
What can we
les
expect in the
enfants de
fall
12 ans et
for
moins? Est-ce
children
qu'on
under
pourra les
12?
vacciner?
Will they
Est-ce
be
qu'ils seront
vaccinated? Will
encore
they
une
be
fois un
allowed
vecteur de
to be
transmission
vaccinated? Will they be vectors of
potentiel du
disease,
variant?
potential transmission of this variant?
C'est Dr. New encore. Merci pour la question.
And sir, thank
Ce que
you.
je peux
This is
dire, c'est
Dr. New
à
again.
l'heure
Thank you for your
actuelle, on
question.
n'a
At
pas
this
comme dit un
point,
vaccin
we do
approuvé
not
pour
have an
les
approved
enfants
vaccine
de
for
moins
children
de 12 ans.
under 12.
C'est quelque chose que
This
je
is
pense que
something
les essais cliniques sont
that
en train
clinical
encore de
testing
se
is
dérouler. Et
trying to determine. They're ongoing.
comme on dit, une soumission peut-être à Santé Canada. C'est qu'est-ce qui se passe
So while
dans
we wait
plusieurs
for
pays. Mais
submission
pour la question,
Health Canada,
qu'est-ce qui va
as
se
is happening in
passer
other
en
countries,
automne?
as to
Je
what will
pense que
happen in
c'est
the
toujours
fall,
une question de regarder c'est quoi la
the
situation
question is again to
épidémiologique
say, okay, what's the
comment dire,
epidemiological picture
en automne, je
in the
pense en
fall,
général,
in general,
dans une communauté.
in a
C'est sûr que
particular community?
les enfants
Clearly,
peuvent encore, comme
children,
on dit, même aujourd'hui, peuvent encore, comment dire,
how
être
can we put it?
infectés avec le
Children
virus
can
et
be
aussi
infected with
peut-être
the
transmettre
virus
aux
and
autres,
can
mais
also
en
spread it.
général,
to others,
ils ont
but generally,
des conséquences moins graves que
the
les
effects
adultes.
on them
Donc,
are
je pense que
less
c'est
than they would be on adults. So I don't think
les maladies parmi les enfants, mais plus la
the
question de
concern is so
transmission
much
aux autres.
about the children, the effect on the children themselves, but on those who surround them. Now, that is why when we look at the situation with the admissible Canadians who are eligible for the vaccine, they really need to get vaccinated. I really would love to have 100% coverage for both doses. If every eligible Canadian is protected, that's less of an issue for children under 12. Not being these children are not eligible at this point for the vaccine, but we're continuing to follow the evidence and the results of clinical studies. Also, we're looking at any submission for vaccine approval.
Merci, Dr. New. Donc, opératrice, à vous pour la dernière question.
Thank you, Dr. New. Operator,
over to you for the last question.
Thank you. Merci. The last question is from La dernière question est de Brian Mullen, Global News. Please go ahead. À vous la parole.
Good afternoon. This question is for the doctors. The Royal Society released a report today estimating that 6,000 COVID-19 deaths for people aged 45 and older are unaccounted for in official statistics. That could mean about two-thirds of the death toll may have been missed. Wanted to get your reaction to that report.
Yes, maybe I will start. So I think this is an important report, and it also goes alongside some of the statistics Canada look at excess mortality. We do know that based on some of the ascertainment of cases and also deaths, that some of these could indeed have been missed or are delayed in reporting. So I think that some of these studies will shed further light on the actual impact of COVID-19. And so I think both this report and the Statistics Canada reports on excess mortality will give us a better picture. Which all to say is that it's even more important than ever to keep up with the vaccinations. One thing that I was really struck by when the vaccines first rolled out, particularly in seniors, not just in long-term care, but then obviously in the community, was how incredibly effective the vaccines were, because we saw the numbers of cases, but also the serious outcomes decline very quickly in those populations. If you imagine this third wave without the vaccine, the mortality impact would have been much higher. You see the deaths didn't rise as fast as the cases. What we saw this time around was actually an increase in ICU admissions and hospitalizations. But the older, more high-risk populations, I think, saw the impact of the vaccines. But those are important studies, because we need to use it for planning purposes, but also for, how do we enhance our data and reporting systems going forwards as well.
On that, how important is it to get better reporting on deaths in Canada, and what are some of the challenges with keeping records of elderly Canadians living in the community outside of long-term care homes?
Yes, I think the provinces and territories that are reporting the cases have really stepped up in this pandemic, and then we had to come back together and say, well, there's more data fields that we need to have put in. Some of the individual case reporting lags the death reporting, because that takes longer to add to the database, and sometimes they're incomplete. So that's one area I think that we need to improve on. Vital statistics really does take quite a long time to come through. The official vital statistics and going to Statistics Canada, for example. So we do need the more real-time estimates, as well as, of course, the formalized reporting later on as well. But I do think that real-time mortality reporting, alongside the other indicators, are really quite critical to any future responses, both in the community and in the different outbreak settings as well.
It's Dr. New. The only additional point I would add is that I think you've raised a very important issue, the critical nature of accurate vital statistics, including deaths, and even before COVID. It's always been, I think, a bit of an issue and a challenge because how a death certificate is filled out, could be seen as a quote, a mundane task. But, especially if someone dies and has multiple conditions, how that I think, the physician fills out the death certificate with quote, what is the, main, cause of death, or what are the underlying contributing factors, how that's filled out, that's what gets recorded and get collected as our vital statistics. So I think it just underscores the importance. And I think it's just something that all of us who are involved in that process, I think, appreciate now more than ever. And obviously, it's something to keep in mind as we continue to strive to do better, from the ground up in terms of the initial collecting or filling out of those death certificates, the data, how it's then collected and rolled up at a provincial level, and then obviously going to Statistics Canada and the subsequent analysis for, as Dr. Tam said, planning purposes, evaluation purposes, etc. Thank you.
Yeah, and just to add that there is the Pan-Canadian Health Data Strategy, and I'm sure that we really appreciate the work of the External Advisory Group, but Dr. Vivek Goel has done some recent interviews on that, and that the fundamental objective of that strategy is to help us all improve at every level, and all the different data providers, how we can do better in the future.
Thank you.
Thank you, Dr. Tam and Dr. New. Merci. Donc voilà qui met fin à cette conférence de presse. That marks the end of the press conference. Merci. Thank you.